Welcome, everyone. This is Diana Metzler from the American Academy of Ambulatory Care Nursing's National Office and the moderator of this session. We're so glad you could join us for the first day of the 2021 AAACN Virtual Conference. We hope you will engage with other attendees by using the chat box on the left-hand side of your screen. You can use this space to talk to other attendees about content in the presentation, or to share ideas of something that has worked in your practice. We also encourage you to upload a profile picture by clicking on the profile in the bottom center of the player and adding a picture. It's always helpful to put a face to a name. If you would like to take notes, you can click on the Notes tab on the right-hand side of the screen. Notes you take there will be emailed to you automatically at the end of the presentation. Also, if you experience any technical problems during the course of this session, please click on the Request Support button in the lower left of the player to receive assistance from our technical experts. And now it's my pleasure to introduce our speakers. Dr. Dwayne Hooks is Assistant Dean and Associate Professor at Augusta University College of Nursing. Susan Nicosia is a community-based placement specialist for the HRSA RECAP grant program at Augusta University College of Nursing. Alexis Popp is a progressive cardiac care nurse extern at Northside Hospital in Atlanta, Georgia. Please welcome with me, Dwayne, Susan, and Alexis.
Hi, my name is Alexis, and I'm the Senior Baccalaureate Nursing student today presenting with Augusta University's RECAP program. We first and foremost just wanted to thank AAACN for the incredible opportunity to be able to present today. Today, we will be discussing adverse childhood experiences and ultimately how that impacts your care as primary care nurses. This work is born out of my own personal and our group's interest in ACEs during a project funded by the HRSA grant at Augusta University College of Nursing, which focuses on increasing students' primary care nursing experiences. Our hope is that by the end of this presentation, all of our participants will be able to identify at least 3 events which are classified as adverse childhood experiences, the potential long-term and acute effects on physical and mental health that ACEs have, and ultimately the way that that affects you as a primary care nurse. What is the unique care approach that is required when interacting with these patients? To first kind of understand the way that ACEs impact our patients and our daily practice, we have to start at the crucial building blocks and pose the question of what is adversity defined as? What meets the criteria of adversity and what doesn't? The consideration for the term adverse childhood experiences emerged as a result of the inquiry of Vincent Felitti, Robert Anda, and their team. This team was working at a weight loss clinic for obese patients in the 1980s and ultimately observed a pattern of dropout rates, significant dropout rates, although these patients had success in their weight loss. So in order to better understand their experience, they conducted interviews and ultimately revealed that over 200 participants reported a significant trauma preceding their weight gain. In many of these individuals, child abuse, specifically sexual abuse, was common, and this weight gain was developed almost as a protective factor rather than a maladaptive behavior or a health-related problem. These individuals believed that, in their words, if they were overweight, they would be overlooked. And that would set a barrier of protection between themselves as the individual experiencing the abuse and the perpetrator of the abuse or maltreatment. Thus, Felitti began posing questions to really understand the ways that he viewed his patients and the ways that their trauma affected their health. He asked questions like, are certain chronic health conditions the result of self-treatment of concealed problems that may occur in childhood? For example, smoking throughout a lifespan and the development of COPD, even things like IV drug use and HIV/AIDS. Are these patients seeking relief from the profound anguish of trauma? This information relating the onset of abuse and chronic obesity ultimately led to the landmark ACEs study, in which Felitti, Anda, and their fellow researchers defined adversity as any event or series of experiences that individually or over time compound to cause toxic stress or physiologic harm. Those are two things that we're going to talk extensively about with Dr. Hooks later in our presentation. But what was found in this study was shocking and crucial to understand more of the inner workings of the relationship between one's mental and physical health. The connections illuminated through this study show how ACEs, or adversity through childhood, provide those crucial insights to connecting our emotional experiences as children with our future emotional health, physical health, and ultimately mortality as a nation. ACEs are quickly becoming one of the most important determinants of health, especially as Felitti in their initial study found that over 2/3 of participants reported at least one ACE, and the presence of a singular ACE increases the likelihood by 65 to 93% to experience an additional ACE on top of that. These listed ACEs that you see on the left demonstrate what Felitti utilized to screen and assess adults of their childhood experience. So in each instance of adversity in the original study, such as physical abuse, sexual abuse, mental illness of a parent, substance abuse, and so on, that all remains within the child's inner circle of what they experienced individually and within their family unit. So a child may experience physical abuse or divorce of parents, or even observe maternal abuse within the home. But these initial parameters were somewhat limited by this kind of focus on the home unit. However, it was what was utilized in the initial study completed by Felitti. This limitation has been referred to, and we've suggested an expansion to consider some experiences outside of the home or outside of that inner circle of the self and the family unit. So a child exposed to community violence, racial discrimination, or bullying even has the potential to occur within the home, but based on various circumstances, this may often occur in an external environment that may involve peers, other trusted adults, or even total strangers. So this new expanded ACEs includes things like food insecurity, poverty, living in an unsafe environment, and lack of social support, as listed on the graphic on the right, just to name a couple. This expansion really illuminates an additional aspect of adversity that's critical to assess, regardless of what the original study established. So as primary care nurses, we can assess, screen for, and really understand the impacts of these expanded ACEs. And this is something that Mrs. Nicosia will go into later detail regarding screening and assessment in our presentation. So what you see here is a depiction of the results of Felitti's initial study, the landmark ACEs study, and assessment of the prevalence of ACEs among 17,000 middle-class adults from 1995 to 1997. One thing I think is really crucial to note here is that this data was collected in a reflective manner. So ultimately meaning these were adults that were surveyed, interviewed, and recalled experiences from their childhood that now fall under the category of adversity. The most shocking realization in this study was that, and illustrated here in this graphic, is that 64% of participants between these 2 years reported at least one ACE. That is over 2/3 of that entire population. Furthermore, nearly a quarter of the participants reported 3 or more ACEs, which places each individual at especially high risk for adverse health outcomes later in adulthood and even acutely in childhood. So in contrast to the previous graphic, this image reflects the data from the 2016 National Survey of Children's Health, and that shows the overall prevalence of ACEs of children aged 0 to 7, and it's stratified somewhat by race, ethnicity, and location within the United States. So in contrast to the previous graphic, this data was reported by the parent of the exposed child. So inherently, we can assume that this places some amount of bias on the data and likely is leading to underreporting, as parents are often a significant contributing factor to adversity.